check those things out for sure. So, clinical trials in the past have been the gold standard for all of these supplements. And as such, we can rely on them at least for accuracy, but they're double-blinded studies or peer-reviewed studies. They're perfect. But they're few and far between for these products for a lot of different reasons, primarily cost. Clinical trials cost a lot. Now, in the last several decades, we have new fun things that are proven to be pretty accurate and very beneficial to us as consumers. We have social proof from, and we have product reviews. I can't tell you last time, well, decades ago, when product reviews started coming out, I started thinking, oh, they're all phony. No, they're not all phony. There's actually people writing these reviews. And I think it's very important that we check them out for sure. If we have 75 people that are saying the product works, it's not as good as the clinical trial, but is it safe? Yeah, it's safe. Did it work for their dogs? Yes. So it's probably being absorbed, and the product with disintegration and absorption is pretty much zero, and we can move forward with that product for sure. So the concept of veterinary formulated, you'll find that on many of these products in the pet area as opposed to the human area. Veterinary formulated is to our advantage. Formulated gives us, not that they're special type products per se, but the labeling is going to reflect veterinary patients. If you get a bottle of vitamin D from your favorite People health food store and it says take X number of capsules once or twice a day, whatever it says on there, it's for 75, 80 kilogram person, a 150-pound person. And can you extrapolate that to your dog? Well, maybe if you dumb down the weight and by a certain and scale it down, that might be possible. But you have no knowledge whether or not the dog dose is the same as the people dose on a per pound basis, or even on a body surface area basis. So veterinary products that are labeled 1 tablet per 20 pounds, so to speak, of dog, or a tablet per 10 pounds of cat, gives you a real guideline and a real advantage when using these products. So what you do want to gravitate towards those type of products. The second thing that you have in your favor is that because it's veterinary formulated, and it's typically targeting veterinary patients, they're probably taste enhanced to get into your dog or your cat, as opposed to some generic capsule that no one is worried about whether or not it tastes good or bad or anywhere in between, because you're going to suck it down and take a cup of coffee whatsoever and make it disappear. Whereas if you hand that to Fido, he's going to say, I don't think so. I have no interest in that whatsoever. Now, maybe if you wrap it up in some string cheese or some turkey or some hamburger, some Braunschweig, it might go down, doc, but it's not going to go down if you just hand me that pill. So the veterinary formulated products are going to give you some advantage from the standpoint of the label's going to be easier to extrapolate to your pet, number one, and it's probably flavor enhanced, number two. Pet friendly along the same lines. It's going to be peeling the pet. Sometimes there'll be liquids that taste good. Sometimes there'll be chewable, chewable gummy bears that will allow you to step and do tricks for sometimes if you're really, really lucky. But that will give you an easier advantage of getting in, because compliance is everything. Time and time again, I say to patient A or client B, give Fido one of these twice a day. One of these twice a day. And, oh yeah, he's sick, you've got to go one twice a day. Well, first day, one twice a day, second day, one twice a day, third day, Fido doesn't like it, it's hard to get in string cheese, it's harder to do this, and the harder it is to get into the pet, the less likely it's going to be on a consistent type basis for that full week, 10 days that those antibiotics need. Otherwise, you could get resistance, you could get problems, you could get all kinds of things, and we don't want that. The second thing is what I call polypharmacy. Polypharmacy is that many of these pet-friendly, many of these veterinary-labeled, veterinary-type products are packaged so that, for example, an arthritis-type medication could have several flavors of anti-inflammatories, such as MSM, such as green mussel lipid perniculatus, selenium, and the other things, all packaged in the one capsule, one chewable thing, as opposed to you going out and saying, oh, I need these 5 things, I got this, I got 5 bottles now, I got to do this. Or if it's packaged in a polypharmacy thing, in a one easy-to-give thing, much more easy. If it's in the powder form, you can, Fido's going to get it, and Fido's going to get better, Fluffy's going to get it, Fluffy's going to get better, and everybody's happy, as opposed to kind of juggling 5 products and one of them they hate, so that doesn't get it, and it's supposed to be balanced. And Fido, and you don't want that. You don't want that at all. So the polypharmacy approach will give you exactly what you want. Um, from the standpoint of kind of a precursor to getting into longevity and live long, keep our pets, maybe ourselves, on the track longer. Um, the basic enemy on a molecular basis turns out to be something called free radicals. Um, and I could give you 12 different slides and try to bring with a bunch of philosophy of pharmacology, physiology, microphysiology on free radicals. But the best way to think about a free radical the best way to think about a free radical is think about this as a little molecule running around. This little Bernese Mountain Dog, the puppy, is a little molecule running around, and this little red tag on him is a active ion charge and a negative charge that is trying to come in contact with other cells, and when it does come in contact cells, it kind of zaps them, and it takes that other cells and it kind of crunches it and clobbers it. That's what a free radical is. It's kind of an active thing that combines with something else and it kind of destroys it and causes the whole body system to get weaker, and in this case, maybe older, age faster. So we want to slow down the aging process and we want to get rid of the free radicals. We don't want any free radicals running around. And so to get rid of free radicals, we use primarily things that are anti-free radicals, so that the a mask. So that if we take the anti-free radical device, which is going to be this surgical mask, and we cover the free radical, we neutralize it and we get rid of it before it attacks cells and damages the cells. And that general process is called oxidation. And to enhance that, we add antioxidants. And there are several classes of antioxidants. In the vitamin group, vitamins A, C, E, the coenzyme Q, B6 does it, I think, and the like. If you want a complete list, you can review the video later. But there are also amino acids that are probably as important or more important than the vitamin antioxidants. Lysine, cysteine, glutathione, methionine, and ALA are very, very, very important substrate antioxidants that are working active in our bodies, and these can be supplemented and the like. The reason I list them and kind of harp on them is that antioxidants, because the need for them to be metabolically active at the molecular level, for them to be active metabolically and active at the molecular level, they have to be high quality. They can't deteriorate in the bottle. That's the bottom line. If you've got an old bottle of the stuff, or it hasn't been handled properly, if it's been shipped in the summer and 120 degrees in a back of a truck for 3 days, schlepping its way across the country, it's probably going to be crummy when it comes right out of the bottle, and you don't have a clue. And you just don't have a clue. Because the handling of some of these products, particularly the antioxidants, is extremely important. And so shelf life is something to be aware of when we're using these products. And many things out of control are just that, out of our control. And the only thing that we can rely on, is the integrity of the people that we buy it from. Unfortunately, I think that really boils down to that. And so the buyer beware. We're definitely looking for quality and not necessarily quantity, not necessarily price. So that was my quality versus quantity note to myself. So good manufacturing processes, true labeling, are all very, very important to keep our kids on the track. Independent product certification, for example. The NASC that we talked about before, we'll talk about again in a second. But I want to briefly beat to death. Forgive me for that phrase. That's kind of what I'm going to do. The supplement oversimplified. The supplement conundrum. Excuse me. The supplement conundrum can be divided in the following groups. Quality control ranges from very good in companies that have independent testing to pretty much non-existent. Companies that crank it out, in my opinion, more for profit than for the benefit of the patient or the consumer. The second conundrum is many of these products have contamination from the same reasons, and many of them are labeled incorrectly. It's supposed to have 800 milligrams of glucosamine or 1,000 milligrams of MSN, and it's not really there. And some of those substances are relatively expensive, and you're paying for the quality, you're paying the product, and it's not really in the label, and that's a problem. And the third thing are discrepancies that you can't really see that we're talking about for the way the product dissolves in the. Because you take the product and dissolve it in water or something on your desktop and say, oh, it works pretty good. Your stomach pH and what's happening in the intestinal tract is clearly different than what's happening in a bowl of soup on your counter. And I wrote down GI release, gastrointestinal release, but what I really want is gastrointestinal absorption, because bottom line, the capsule's got to break down, it's got to swim around in some stomach juice, intestinal juice, going to get into the small intestine. Most things are absorbed in the small intestine and not the stomach, and get sucked up into the system so that we can benefit from the product, So, a brief plug for the NASC, the National Animal Supplement Council. Oversimplified, nothing's perfect, but if this label is on the product you have, I give it 2 thumbs up. And if the product's not there, I have no idea. Unless you've got some other independent third party, which a couple companies do, by the way. But unless you have third-party certification, that's what this is, you're kind of in the dark. The other thing, because this is the National Animal Council, National Animal Supplement Council certification, the products are animal products. And so the companies that have gone the extra mile to do this are making generally products that satisfy all the criteria that we've mentioned before. They're veterinary recommended with the veterinary labeling. They're also not outsourced. They're also compiled with the polypharmacy that we talked about. So instead of having 5 products with 5 tablets, you've got them all in one, and those are all common with the NASC label. The NASC label was the NASC is a separate council that's totally independent. Company A that makes product B sends it to the NASC. The NASC says what the label is matches what's in the content. What's the label matches what's in the content. And they have very strict guidelines, and they actually now have a relationship with the FDA. The NASC does have a relationship with the FDA, and they have guidelines that dovetail. So you have not the equivalent of an FDA certification, but you at least have the equivalent of what you see is what you really get. Doesn't mean the product has had clinical trials, but it does mean the product is exactly what's in the label, and the labeling for 1 capsule per 10 pounds, for example, is accurate. And in summary for the NASC, I really believe that the label means we actually care. The company actually cares about its consumers because it's gone that extra mile to provide that product for us, for our dogs. And I expect that getting that approval costs, and we have to pay that cost, but I believe that cost is 100% worth the effort. So briefly, before we run out of time today, I want to talk about transitions. How to start Fido on a new supplement. How to start Fido on a new supplement. So very much like diets, when we change a pet's diet, we do gradually. So I want you to think of the concept of plateaus. The plateau is going to vary from product to product. Plateau is going to vary from patient to patient. You know your dog, you know your cat. If they're the chronic vomiter, if they're very sensitive stomach, if you make any change whatsoever, they're going to have a problem. The plateau needs to be long. Instead of 3 or 4 or 5 days, the plateau might be as much as 10 days. What's a plateau? A plateau is when we make a change. So every time we make a change, we use a plateau of several days. So to start out with, you want to take your target dose, your veterinary recommended target dose, and start with about 25% of the target dose for the first class, 2 or 3, 4 days, up to 5 days for the average dog with this, or the average cat. We'll come back to cats in a second. But the average dog or cat with a sensitive stomach, with no sensitive stomach, about 5 days, 3 to 5 days. In 5 days, if everything's fine, use 50% of the target dose. Another plateau, everything's fine, 75%. Another plateau, 100% forever, and adjust it according to what your veterinarian wants to adjust it to. What happens if there's a problem? Well, if it's a little problem, just stop and cut back to the last level. Stop and cut back to the last level. If you get up to 75% and all of a sudden you get, I don't want to eat this, I get some soft stools, immediately cut back to that 50% level and you should be fine. You should be fine. If you start out with a little bit of a problem, stop. Go back to make sure you're 100% normal, and then go in with a trickle and start working your way. If you have any problems there, contact your prescribing veterinarian and reassess whether we really want that product, other product, or what we really need. Not every product is going to work for every dog or cat. You have 2 potential complications when you add these. One is side effects, usually gastrointestinal, tummy, poor appetite, maybe diarrhea, vomiting would be the worst type of side effect. But the other is palatability. The other is taste and flavor. Cats are notorious for, I just don't want this. There's no reason that you should be putting this in my food because I like my tuna just the way it was. So you may really have to sneak up on them. And if they really need the supplement, you may have to end up with a different mechanism, such as a liquid that you can squirt in their mouth or whatsoever to get it into them. Because cats notoriously don't like things mixed in their food. Cats notoriously just won't tolerate things mixed in their food. Now, dogs will either, but dogs are usually easier to get stuff into than cats. So, today we talked about supplements. We talked about the antioxidants that are useful for them. We talked about complications in the supplement conundrum. We talked about how to transition, and we're going to have to save aging supplementation for a future episode. We're going to save that for a future episode, and we're going to say thank you all for joining here today. I can't wait until I see you in our next episode. And we'll go to questions. We'll go to questions here in a second, if I can find questions. Oh, I see a note from Amy that had sound. Thank you, Amy. I appreciate you letting me know. She said sound's back. Thank you very much. Don said I had no sound too. Need to learn how to work this thing. I'll get better next time. I promise. Promise. Anybody have any questions regarding supplements in general and specific what we talked about, or anything you're worried about your pet may need? Anything, any supplement that you got? Amy said she watched even though I wasn't talking. You're good. I appreciate that. All right, maybe the sound was on my replay, and I'll be able to get it from the recording of my computer. I find that doing these lives fun and challenging, but there's only one way to push all these, to keep track of all these buttons. Maybe I need a new tech assistant. But Amy says, how do I know if she needs a calcium supplement? Good question. How old is she? And refresh my feeble memory, how old is she? Don says, good information. I think I'll buy them from my vet. Easier that way. So Dr. B can do all the work for me. Yeah, well, that fortunately or unfortunately is a very accurate observation. I think when you buy the products from your veterinarian, he's done a lot of work for you. Um, in the past, I've talked about 8 criteria for selecting these things. I do that for all of them for 2 reasons. One, I want my clients to have the right product, but 9 out of 10 of these products, sooner or later, I'm going to be taking home and putting in my pets. And I want them to have the right thing. I don't want to, it's difficult to, you get a jar of pills and your doc says, take them for your blood pressure or take them for this or take them for that. And you think, well, I better take them. And you slug down all these pills. And it's not that big of a deal. You come home with 3 bottles of drugs, hopefully antibiotics for a short-term thing. But if you're going to be giving a supplement long-term and you got to get it in long-term, it gets old fast over time. And particularly if they're not a chewable thing that they have clients come in all the time. Oh, it tasted. Oh, he just sucks them up, doc. No problem. And I'm happy for them. But that's not the rule. The rule is, I tried it in this. I tried it in that. I can't get it in that. What am I going to do? Well, what we can do, if we have to, is possibly have it compounded by a compounding pharmacy into maybe a liquid that's in a tasty flavor. But you can go through all that and have the wrong taste. Sometimes cats are notorious. There's if you give a cat a pill, sometimes you can give a cat peanut butter and they can drool for 3 hours just because they're a cat. Should I say that? I have cats, so I guess I can. So Amy says she just turned 4. Sardines, livers, eggs, and meat. Chances are you don't need a calcium supplement unless the blood test showed you're low in calcium. And if you're worried about calcium, the potential, it's very, very uncommon for calcium to be low in cats or dogs for that matter. Calcium in older patients can be going up, and that's a signal of potential problems with kidneys or liver. If it really goes up, it's actually a marker for potentially for thyroid, or even some types of tumors will have have increased calcium type thing. Comment on calcium decades and decades and decades and decades ago, before good balanced diets for puppies, it was common practice to add calcium to puppy diets. And that changed really a long, long time ago. And it's still in the literature, and there's still some people that are misguidedly giving puppies calcium. Bad. If the only way that you should be giving a puppy calcium is if your veterinarian's puts a gun to your head and says he's got XYZ problem and you need to be giving the calcium, because calcium supplementation in puppies will probably give you a huge problem, particularly if you have anything near a normal balanced diet, which the diets today should be healthy for our puppies. So Elon says, I've been looking for vitamins for my cats. Senior cats with arthritis, there's a super supplement out there called kitty cosequin, feline cosequin. Cosequin, and they're little chewable type things. They're veterinary formulated, and they taste relatively good, almost as good as Pounce type treats. And most cats will eat them without too much messing around. And so that would be a really good choice. Oh, you're welcome, Amy. If you're looking for a general vitamin for cats, RX Vitamins makes a balanced health support that is an excellent product that you can use as well. RX Vitamins, um, can't think of the name. It's their general health support product. You're welcome, Elon. You're very welcome. Always glad to help. Any other questions, issues that I can address for you? There's a time delay, so I'm delaying time, and I can't figure out. I have, you can, when you set up these live things, you can add time. I'm not quite sure why you would want to do that, um, but there's still like a 10 to 20-second delay between what I'm talking on my screen and the monitor on YouTube is doing over here. And I apologize for the sound earlier. I didn't have my headset on to listen to myself. Add that to my checklist. So next time I will have the headset on, I'll have the sound on, and things will be looking good. Um, Checking the chat one more time. Nothing's come in since the last round of thank you. So I want to thank you for joining me here today. I want to thank you for caring enough about your dogs and your cats to get good information about keeping them on the track for a good, long, healthy period of time so that I can help them and I can help you become worry-free. Thanks for joining me here today. I can't wait until I see you in the next meeting.